Hello, my name is Noor. In this video, we will be discussing the effective communication between radiographer and patient. Communication is essential between a radiographer and a patient for outstanding patient care. Follow me and let's dive into how to implement effective communication between patients and radiographers. Step 1. Understand patient history. Before greeting the patient into the room, the radiographer has to go through the patient's details that include the name, age, clinical history, and the examination request. A radiographer must make sure that all the machines used in the procedure are functioning well before meeting the patient. Step 2. Meet the patient. After knowing the vital details, the radiographer should greet the patient and address them appropriately by stating their name and introducing themselves, as well as welcoming them to the examination room. Step 3. Verify identification. It is necessary to check and verify patient's identification. Before beginning the examination process, the radiographer will ask the patient about his or her medical history. To appropriately document the management of the patient while under their care, it is essential to know whether the patient has ever had an X-ray recently. If the patient is a female, then the radiographer must ask about her LMP prior to performing a radiological examination, so as to not irradiate the patient who may have missed her period or may be pregnant. Step 4. Prepare the patient. A staff member will first lead the patient to the changing area and direct them to get dressed into their hospital gowns. Jewelry including necklaces, watches, rings, and bracelets should be taken off before the X-ray procedure. Step 5. Start the examination process. As the patient enters the X-ray room, the radiographer will instruct the patient to stand in front of the X-ray machine and position them by making sure that the hips and elbows are gently pressed. The radiographer will ask the patient to take a deep breath and hold it for a few seconds. For accurate results, the radiographer can demonstrate the proper way of breathing to the patient. Step 6. Thanking the patient. After finishing the procedure, the radiographer should thank the patient for their cooperation. This is compatible with guiding them to the next step that they need to follow, such as directing the patient to the physician.